If you have one of these mental health conditions, you probably want to avoid just seeing a regular therapist. As a mental health and addiction counselor, if someone comes in with one of these disorders, I'm referring out unless I know what the hell I'm doing. And the last one is the most important because it's the most deadly. First is OCD, because obsessive compulsive disorder is often quite severe. Individuals have persistent obsessions that sometimes border on delusions. Then they need to do these compulsive behaviors in order to alleviate their anxiety. For example, chronic hand washing or not being able to have things on an even number. Next, we have addictions, and whether that's alcohol, drugs, or even behavioral type addictions like gambling or sexual compulsivity. Many states actually have a specific licensure for counselors to have because of how unique and delicate these situations can be. Now, many therapists are able to treat it at the lower levels. However, if it's moderate or severe, you want to see someone who's going to be able to recommend the appropriate level of care or provide it themselves. Then we have severe trauma. Now, everyone comes to therapy with some adverse experiences they could benefit from talking about. However, when it's something more severe, like PTSD from a combat trauma or a singular incident like an accident, perhaps it's borderline personality disorder from ongoing childhood abuse, you want to see someone who knows what they're doing, whether that's tailored talk therapy or something a little more innovative like EMDR. This last one is so severe, I need to be careful even saying its name. Let's just call them disorders of feeding. These come with some of the most insidious obsessions around weight gain that often lead people to extremes like restricting. For some people, they take it so far that they struggle with malnutrition, even organ failure, and this is why it is the deadliest mental health disorder of them all. There's a wide spectrum here, but if it is a primary issue, you want to see someone with extensive specialty. Often people could require inpatient treatment. Often you need to have other professionals like a psychiatrist or even a nutritionist. All right, so if you've had one of these, I want to know, was your therapist equipped to help?